We are going to discuss how to answer one best answers question. One best answer questions. Nilain, Faculty of Medicine is adopting one best answer questions. Now it's more than, I think it has been adopted in 2008. And so it is more than 12 years now, more than 12 years. And so it is, although a lot of argument is going on regarding the one best answer. As a surgeon, I would like my house officer or my resident registrar to take an action in every patient they face, if they know or if they don't know. Because if you encounter a patient and you don't do anything, this is a very bad thing to do. So any patient, you have to exert an effort to do what you know to help him. So the message of medicine is to do something to help, to try to do to be benefit, not to be harmful. Unfortunately, one best answer will not apply to this message of medicine. Because if you don't know the advice in one best answer, don't attempt. Okay?
Good.
And this is again is the message of medicine in general. Okay, next slide. Most undergraduate and postgraduate medical examination nowadays of knowledge now use the single best answer format. Although I have said the drawback of one best answer that it makes the student or the doctor not to take action when he is not sure. Okay, but still it is the best way of assessing the knowledge in medical practice. Question structure and content. STEM structure. The STEM could contain only information that is relevant. In constructing one best answer, you have to put in the STEM the relevant information. Avoid inclusion of a lot of clinical details unnecessary. The STEM should be structured as follows, making sure only information relevant to the question. That is, so if vital signs do not have any important, exclude them. If information you are going to give in the STEM is not going to guide the answer, it is an extra information. It is unnecessary. This is regarding the structure. And I am starting with the structure so as to know how the examiner put the exam. Then any information in the STEM is important to answer the question. So as we have said in the long problems, in the short problems, you have a keywords. Here also in the one best answer you have in the STEM constitutes the keywords for answering the questions. If you don't read the STEM well, if you don't understand it, then you will be in trouble. So the STEM should contain only relevant information. Okay? Okay, next. These relevant information may contain patient details, gender, age, presentation complaint, history of presenting complaint, relevant past medical history, family history, and social history, observation, vital, Glasgow Coma scale, physical examination finding, results, laboratory radiology. May contain some of these relevant. If the question is about presentation, then you will the STEM will concentrate on the gender, age, and presentation, and the presenting complaint, and you may miss some of the results of the physical examination finding if they are not relevant. So you will include one of these 7 parameters or 7 sayings if they are relevant. Okay, patient details, gender and age, presenting complaint, history of presenting complaint, relevant past medical history, social history, family history, observations, vital signs, Glasgow Coma scale, physical examination, and laboratory results or radiology results. Next. Acceptable question style. Ask for the best answer, not one that is true or false. For example, what is the most likely? يبقى دي حاجات بتديك clue. What is the most likely diagnosis? And he needs, the answer is the most appropriate for the scenario given for the STEM. مثلا انا هتيجي تشوفوا الاكزامبل، مثلا يقول لك a 40 years old gentleman presented with burning nutrition, tripling of urine, and اقول 65 years old gentleman presenting with features of symptoms of prostate, benign prostatic hyperplasia. The most likely diagnosis is prostate hyperplasia, although other things can cause like stricture, like infection, UTI will cause these symptoms. What is the most appropriate initial management step? دائما السؤال هنا question example دائما one best answer constitute of a stem and a question, and the question is most likely one of these. What is the most likely diagnosis? What is the most likely treatment? What is the most likely the investigation? What is the most appropriate treatment? What is the most appropriate drug? And so on and so forth. Which of the following investigation would be most useful? Most useful. فكلها about the best. The best maybe the common, the most likely, the most appropriate, the most fairest. Okay. Next. Which of the following investigation would be most appropriate to perform fairest? Okay. Check your question passes the best practice cover test. The candidate should be able to answer the question solely from the stem of the question with the answer options covered. دي أهم حاجة. يبقى من الستم most of the student will get the answer. Okay. اللي هو دي بنسميها شنو؟ the cover test. تغطي الإجابات وتقرأ الستم you will pick up the best answer بدون ما تقرأ الاوبشنز او الديستراكتورز. Okay. Any question has an stem, a question and options. 5 options usually لانه هنا بنعمل 5 best of 5 but maybe 4. Okay. Okay. Next slide. We have gone back, but what things to avoid: the inclusion of irrelevant background information. زي ما قلنا أي irrelevant information, this will make the stem long and will not add to the benefit of the answering this question. The inclusion of the reader in the question. And you don't need, you are a junior doctor, it's not acceptable, it's not allowed. Better to con a 37-year-old patient present with. A better format would be a 37-year-old male presents with to the emergency department with, rather than you are a junior doctor working in emergency and actually an emergency when a 37-year-old patient present to you with كده. Better to make it to exclude the reader from the question. A 37-year-old male presents to the accident and emergency department with so and so. The use of negative. What is the least likely diagnosis? Better not use the least likely. What is the most likely? Better. What is the least likely? اللي هو is a negative message. مش كده? Is not the diagnosis of this patient. So better to give the diagnosis, the positive questions rather than the negative questions. Okay. As I like, we'll come to this. Tips for writing high quality answer options. Provide 5 successive answer questions, 5 successive answer questions. Options. Answer options should be homogeneous. Should all be a diagnosis, treatment, anatomical location, etc. You cannot put one as a diagnosis, the second as treatment, the third as anatomical location, the fourth as operation. So they have to be in one category. If there's a question about diagnosis, they must be all 5, they must be diagnostic tools. If about treatment, the whole 5 options, successive options should be treatment and so on and so forth. All answer options should be balancable, مبلوعين. Balancable يعني مقبولين and familiar, but one should be better than the others. You cannot put 5, if you are putting a question and we put 5 options, if one of the 5 options is not balanceable, that's you can notice that this is odd, then this is this is not a high quality question. The correct answer should be evidence-based and widely agreed upon by experts. It is not and an individual opinion. It is evidence-based and widely agreed upon by experts. So the one best answers usually is revised in a meeting in the department. Every department will revise the one best answer question one by one, usually, and they will say this question is good, the answer is acceptable, and so on. So they will accept, and they will determine the pass mark of this candidate. The examiner will say this is a very basic question. I expect 80% of the student to know the answer. Okay, so the pass mark is 80 in this question. The other will say no, this is 40. The other question is 40. The other is 20. So we'll pick up the whole pass mark of the whole exam and will subside. Will be divided will be divided with the number of the student, with the number of the question actually. If you have a 60, and then the first was the pass mark was 80, the second was 40, the third was 30, the fifth, and so on, so up to the 100 or 60, then we'll sum the pass mark agreed upon in the meeting, and then will be defined as the number of the questions so as to reach a medium acceptable pass mark. Okay, this is how the pass mark is calculated in one best answer. It is not a fixed number. Explanation. Identify and explain the correct answer. The explanation should first identify the correct answer and explain why this is the most appropriate answer. You should provide some educational value relating to the answer. If the answer was a diagnosis, you would explain that the diagnosis is how it typically presents. Okay? Yes, you get explanations. Then in answering one best answer questions, has to have some explanation why you choose this as the best answer. Next, an explanation why you don't choose other options were less correct. Usually, we are talking about the best answer, then the other are less correct. They are not wrong. Okay. After explaining the correct answer, the explanation should then move on to discuss why the other possible answers were less correct. You should briefly explain each of the incorrect answers where possible. That's to say, if they are diagnosed, you would briefly describe how each might typically present. Okay, we'll come to this. Next, how to know the best answer? The best answer may be the commonest, the serious, the important, the suitable, etc. So it is in comparison to other, it is the commonest, it is the serious, it is the most important, it is the most suitable, and so, the most logic, the most, okay? So it is the best because of that. Okay? Any questions so far? You go back, please. I think you missed something. Okay, next. انت بتنط two slide ولا ايه؟ next slide. طيب كان في عنوان الرحله. Okay. نجوب نشر الاكزامبلز. Yes, this is, I think, example. نشوف a 50-year-old male developed fever and rigors following laparoscopic cholecystectomy. The likely cause is following laparoscopic cholecystectomy. It's not a major operation. It's not a major operation. Immediately following any surgery, is that laparoscopic? Why? What's the problem? The keywords here, what are the keywords? يلا نسمع منكم. خلاص أنا قلت Yes, what is the keywords? Ahmed. Yes.
The age, gender.
50-year-old male. Yes.
Yes. And presenting complaint, fever and rigors. History of laparoscopic cholecystectomy. All of these.
Yes.
So the likely cause
the likely cause دول عملنا ليه the 50-year-old male عملنا ليه laparoscopic cholecystectomy وبعد 24 ساعة لقيته عنده fever and rigors. المفروض يقول develop fever and rigors 24 hours following laparoscopic cholecystectomy. What is the most likely diagnosis?
Malaria, UTI, atelectasis, wound infection, cholangitis, and possibly injury to the biliary system. So the best option here is cholangitis due to, I think, biliary leakage.
to care immediately after laparoscopic cholecystectomy. Biliary leakage is not given here.
I think I said cholangitis.
Yeah, you need so as to happen cholangitis to happen, it is how much? يبقى السؤال ده المفروض يقول 24 hours. There is something wrong in this question عشان كده انا جبته، عشان كده ما كنت اتخيل دي السلايدز حصل فيها لخبطه في الترتيب. هي 24 hours following، المفروض يكون في 24 hours هنا following laparoscopic. اوكي؟ ها؟
I think
Okay. Atelectasis
more
yes.
common.
It's very 24-hour fever usually is due to atelectasis. But if it is few days after cholecystectomy, then you are right, Ahmed, that to have cholangitis. Okay? But wound infection will need 5 to 6 days to have a wound infection. مش كده؟ Malaria, it has to have, usually it's not that common postoperative cause of fever. Malaria is not the common. It's not rare, but it's not the common, especially in Sudan, where a lot of mosquitoes and malaria.